Hello, I'm Michael Shuler with Athens Orthopedic Clinic. Today we're going to talk about trigger fingers, the symptoms, possible treatments for that, as well as even surgery, as well as potentially the recovery after surgery. So most people come in complaining of pain in their fingers. They typically talk about pain along the MCP joint. They typically talk about the finger locking down or sticking. Some people even describe the finger jumping out of joint. The finger's not actually jumping out of joint, but what's typically happening is the flexor tendons, the tendons that bend your fingers down, run through a tunnel. That tunnel gets tight for one reason or another, and in doing that, that tendon can get caught in the tunnel. So I typically draw what's going on an x-ray. You have a tendon that comes down this way that bends the tip of the finger like so. You have a second tendon that comes up this way and splits and bends the joint like that. These two tendons run through a little tunnel right here called the A1 pulley. That tunnel gets tight. When it gets tight, the fluid that lubricates the tendon forms a little ball right there. When you go to bend that finger down, that ball gets stuck in that tunnel and then you get locked down like that. Typically what happens is the tendons that bend your fingers down are stronger than the ones that straighten them, and so you can get it locked, but then you can't get it unlocked and the finger's stuck like this, and sometimes you have to pull that finger out. So risk factors for trigger fingers, typically if you have diabetes, that can certainly be associated with it. You do not have to have diabetes to have a trigger finger. The other indication is typically considered overuse. The problem is, how do you diagnose overuse in a hand when everybody's using their hands for everything? So treatments for trigger fingers are fairly limited, unfortunately. One option is to grin and bear it. It's certainly not a good option, but you will not cause permanent damage typically by ignoring this. Sometimes they'll go away on their own. Next option is an injection. Typically, the only real injection that's offered is corticosteroids. The problem with steroids, especially in diabetics, is it can make their sugars go crazy for 4 or 5 days, and typically doesn't work as well. We have looked at amniotic fluid, which has showed some promise, and actually are currently continuing to examine that. Lastly, the third option is surgery. If we perform surgery, we make a small incision at the base of the finger and the palmar aspect of the hand. We release that tunnel that the tendon's getting caught in. You typically have 3 stitches afterwards. You're placed in a splint that holds the finger still for approximately 3 days, and then after that, get you wiggling and moving, really doing whatever you can. So surgery is typically performed either under a general anesthesia or a local, depending on the patient's preference. It is performed in a surgery center or at the hospital, again, depending on patient's capabilities. It is not done in a procedure room. So a couple things to consider with regards to both non-operative and operative treatment. Depending on how long the finger has been popping or catching, or if you've not been able to make a fist for a long period of time, you may experience some fairly significant stiffness post-operatively or even after an injection. So certainly be aware of that. Additionally, if you have something called Dupuytren's, which is a genetic condition where you have some knots at the palmar aspect of the hand, surgery can stir those up where you ultimately end up with a finger that's not catching or locking, but sometimes has a little bit of a contracture or a bend in it due to that genetic disposition. So one other thing to consider, some people, especially people that have hyperlaxity or hyperextension at the PIP, can experience a little bit of snapping after surgery. This typically goes away. What people describe is they go to start making a fist and the finger actually hyperextends for a second and then kicks back in and starts to flex. This is not a reoccurrence of triggering, but it's really due to some hyperlaxity in the fingers. Typically this goes away without any need for additional treatments. So after surgery, things to expect, we typically put the hand in a splint for approximately 3 days. It maintains the finger in full extension. It's hard to get extension back after surgery if it's been flexed for a long time. After those 3 days, you can take the splint off at home and really start to work on using the hand as much as possible. The finger will typically be swollen for 1 to 2 months, depending on how long the problem's been going on and how stiff you were before surgery, but really I encourage people to use the hand as much as possible. This will accelerate your ability to use the hand Stitches are taken out at 2 weeks. You typically have 3 stitches. Additionally, you can have a trigger thumb. Trigger thumbs typically respond to surgery a little bit faster and don't have quite the stiffness that the lesser digits have. So that about wraps up trigger fingers. Hopefully this has been helpful in understanding a little bit about what's going on. I'm happy to answer any further questions.